Senator McPhedran. Oh, I'm sorry. Did you have a question? No. Senator McPhedran.
Merci, Madame la Présidente. Honourable colleagues, 3 years ago, during the final debates on C7, I acknowledged that disability rights organizations would lose that round when Bill C7 became law. But it would not be the last time that senators would be tasked with addressing the discriminatory impact of medical assistance of dying, or MAiD. And here we are. Every senator is paying close attention to our responsibility to consider carefully this bill, appreciating the complex and profound issues raised by C-62. The expertise and resources available to us in our readings of this bill are also complex, diverse, and often divergent. I want to thank Senator Gold for his helpful review of the reasons to support Bill C-62 at this time. And I want to thank every senator who has spoken thoughtfully, sincerely to this debate. Almost 50 years ago, I graduated from Osgoode Hall Law School, and in the early days of litigating with Canada's new constitutional charter rights, I was a lawyer with the Arch Disability Law Centre, the first legal clinic in Canada to specialize in disability law and advocacy. I welcome this opportunity to add to this debate. And I want to offer analysis derived from experts on disability rights. Last Friday, I sponsored a media conference of these experts where Krista Carr, Vice President of Inclusion Canada, noted, "Fundamentally, we know that providing MAiD to persons with disabilities not at the end of their life, as opposed to suicide prevention and other social and economic supports, is unequivocally discriminatory. Disability organizations across this country have been clear about this and predicted that if we expanded MAiD to people with a disability not at the end of life, people would die who desperately wanted merely to be able to live a life of dignity with the support needed to do so." And right we were. If you look at the data on MAiD deaths in Canada, we have already outpaced countries who have had some form of legalized medical assistance in dying for years longer than we have. We are being seen as having the most permissive MAiD regime in the world. The bodies are literally piling up, and we are now talking about expanding it further? End of quote. In the Hill Times some weeks ago, law professor Daphne Gilbert, a proponent of MAiD expansion, called on the Senate to reject C-62 in the name of defending human rights, comparing access to MAiD to the fight to defend the reproductive health rights of women. I would like to explore this point further. MAiD advocates who argue from a rights perspective are correct that an understanding of human rights is key to this debate. But, in effect, some of their arguments actually discount disability rights. Also in the Hill Times, law professors Isabel Grant and Trudeau Lemons questioned appropriation of feminist arguments on bodily autonomy and reproductive choice as a sleight of hand in attempting to persuade the Senate to overturn the decision of the Special Joint Committee on Medical Assistance in Dying, where senators have been fully engaged members making substantive contributions. The UN Convention on the Rights of Persons with Disabilities, which Canada ratified and is obligated under international law to uphold, defines a social model of disability, which requires states to recognize the disabling nature of attitudinal and environmental barriers that hinder a person's full participation in society on an equal basis with others. In other words, substantive equality. Colleagues, some of you may be aware of my decades of human rights work and my contributions to drafting equality provisions in the Canadian Charter of Rights and Freedoms entrenched in the Constitution of Canada. I will be sharing more resources from a range of experts in my speech, but I wish to state that, based on the social model of disability rights and my own experience, I find no equivalence. MAiD, for someone with a disability who is not at the end of their life, for example, someone with a mental illness, is not a disability right, and it is not equivalent to the right to reproductive choice. To quote Professors Grant and Lemons, abortion rights enable women to thrive in a society where they have historically faced social, political, and economic inequality. Just as disability rights are crucial for people with disabilities to thrive in an ableist society that often degrades the value of their lives. In light of the stark data we are now starting to collect on MAiD and its impacts on socially marginalized people, particularly those living with disability, let us be reminded of the cautions raised by the 3 independent UN experts when C7 was before us: the Special Rapporteur on the Rights of Persons with Disabilities, the independent expert on the enjoyment of all human rights by older persons, and the Special Rapporteur on Extreme Poverty and Human Rights, all alerting that human rights violations were likely to occur under Bill C7's expanded Track 2 access. We here are charged to uphold the rule of law in Canada, including the rights in our Charter and international human rights treaties ratified by Canada, such as the International Convention on the Rights of Persons with Disabilities and the International Covenants on Social and Economic Rights and Civil and Political Rights, all accepted by Canada as essential treaties in our adherence to human rights law. In their joint advisory to Canada, the 3 UN experts conveyed that MAiD legislation, quote, appeared irremediably entangled in ableist assumptions about people with disabilities. They elaborated that, quote, the eligibility criteria set out may be of a discriminatory nature or have a discriminatory impact, as by singling out the suffering associated with disability as being of a different quality and kind than any other suffering. They potentially subject persons with disabilities to discrimination on account of such disability. The alarms they raised then are sadly proving prescient. Last week, disability community advocates from across Canada came to Ottawa to provide testimony to the Canadian Human Rights Commission on key issues facing people with disabilities. Their list was long, but their top concern was the impact of MAiD criteria for eligibility on persons with disabilities. Colleagues, when we welcomed the UN Special Rapporteur on Religious Freedom to this chamber recently, you will recall how I emphasized that these human rights special rapporteurs are chosen for their internationally recognized expertise and that their independence is reinforced because they work pro bono. I hope you agree that it is significant that 3 of these experts took the extraordinary step of warning Canada about the likelihood of disability rights contraventions in our MAiD laws, sending a joint advisory letter to Canada. And today, the new UN Special Rapporteur on the Rights of Persons Living with Disabilities conveyed her concern and intention to monitor what evolves in Canada. Let us also be reminded that expertise comes in many forms, not just from one professional discipline. UN and Canadian disability rights experts continue to try to alert Canada that dangerous and discriminatory situations happen to people living with disabilities, far from the notice of this chamber and far from our being able to do anything about their situations in real time. The joint advisory from the UN experts specifically warned that expanding MAiD to those whose sole condition is a mental disorder will lead to even more people applying and receiving MAiD due to socioeconomic deprivation, also known as being poor. They are justifiably concerned that MAiD expansion is being viewed as an easy answer and that it is caused by the economic and social inequality that many people with disabilities are forced to live with. In my remaining time, I wish to bring more expert voices from a number of disciplines and their arguments to your attention for your respectful consideration. The experts at ARCH have a long and distinguished track record on defending the rights of persons with disabilities. If there is a cacophony, as disparaged by Senator Kutcher, these expert voices are not in that category. ARCH lawyers report staggering increases in the number of clients who've applied for or who are seeking to apply for MAiD Track 2, not because of their disability, but because of suffering related to barriers in society, including living in poverty and lack of accessible, safe housing. ARCH lawyers have testified that they have clients who can't get the services they need, such as attendance services to assist with the basic activities of daily living. Instead of getting services to support them to live with dignity in the community, they are often given the impossible and false choice of living in the community in unsafe conditions or moving into a hospital or long-term care institution where they may get some services, but they are required to give up their independence, their work, their relationships. These are not people who are dying. These are not people who want to die. They are people living with disability who are entitled to a level of support that provinces do not offer, a choice that is being made. To quote ARCH Executive Director Robert Latanzio, people with disabilities are dying by MAiD not because they want to end their lives, but because they are suffering due to dehumanizing social and economic conditions. Exposing MAiD to people whose only condition is mental illness will only exacerbate this. End of quote. Senator Kutcher repeatedly referred to the cacophony of, quote, erroneous and inflammatory, quote, anti-MAiD activists, quote, who have, quote, drowned out voices and, quote, fed us fear and falsehood. Colleagues, that may be how the senator perceives those who have a different view from his. But the experts that I'm bringing to your attention are not cacophony. They deserve respect and acknowledgement of their skills and their direct current testimony about real people living with disability whom they know and who are in such deep crisis that they are choosing death because they cannot live in dignity. These experts are reporting on direct experiences in good faith and for good reason, and I ask you to consider the human rights analysis they offer with respect. More than 100 Canadian disability support organizations came together to oppose Track 2 and Bill C-7 because they all have clients who cannot get the mental health services they need to live their lives with agency and dignity. StatsCan 2022 data indicates that wait list times for community health counselling are increasing year over year. In a national poll conducted by the Ontario Psychiatric Association with analysis based on data collected from December 7, 2023 to January 23, 2024, 61% of psychiatrists stated that MAiD for mental illness should not be allowed. 81% said the medical system is not prepared for MAiD for mental disorders. The disability community has been articulate in asserting that MAiD violates Canada's international human rights obligations to people with disabilities under the UN Convention on the Rights of Persons with Disabilities in certain respects. One of those rights is the right to life. Genuine choice is a central pillar of the right to life as it applies to assisted dying. Exercise of this right requires that assisted death is chosen without any outside coercion or pressure. Deprivation is outside pressure, and it is more than a moral question. When social, economic, ableist obstacles and pressures impede the provision of full rights to persons with disability, then their autonomy and ability to make free choices is compromised. Social isolation, lack of supports, persistent poverty, lack of safe, accessible housing, All face social and economic pressure. They are often not in a position to exercise free and unconstrained choice. UN disability experts have been clear. Economic and social rights are key to affording genuine autonomy instead of the myth that is currently in the law at the moment. Your Honour, I would ask the Chamber if I might be allowed a little more time. Someone said no.
Have I heard a no? I heard a no. Sorry, Senator McPhedran. Senator